So yes, thank you so much everybody for joining us. Excellent presentation for you today. I'm going to go ahead and turn it over to Caitlin and Elizabeth.
Thank you. Good morning. We will be presenting today on security by design. We're going to cover some concepts of CPTED, which is crime prevention through environmental design. My name is Elizabeth Robertson, and I am a healthcare architect at HFG Architecture in Tulsa, Oklahoma.
Hello, everyone. My name is Caitlin Cox, and I am a senior interior designer also at HFG. So today we're going to talk about the impact of violence in healthcare. Today, the risks specific to safety and security in rural health. What is CPTED and some CPTED principles and strategies to consider for your facility? At the end, we'll have time for some questions and answers. So as we get started, it is important here to understand and acknowledge the impact of safety and security in our healthcare environment and how serious it is. Our current statistics indicate that violence in healthcare is so prevalent that no one is immune from its effects. How an organization evaluates and responds to their vulnerabilities and prepares for events have a direct effect on the patients, staff, and the community. So this is an important issue to understand and be prepared for your specific healthcare environment.
So we have a little warning sign here. In some of our other presentations, we have more videos and things that may trigger some emotions or some things that may just alarm you. And so we try to put this little signal or icon at those slides. So we're just letting you know that ahead of time. This first slide is something personal to our area.
The death toll in tonight's mass shooting in Tulsa has now climbed to 4, plus the shooter. Local officials spoke just moments ago. I want to go back to CNN.
So were you guys able to hear the audio on that?
Yes, we were.
Great, okay. So Caitlin, she had a personal experience with this, and I'm gonna let her share that. It's just a recognition that some of this violence is happening in healthcare settings, can affect anyone at any time.
Yes, so this is pretty much the definition of close to home for me. On this day, my husband got home from work as he normally would, and reports started coming in on the news, and he started getting contact on his phone. He had to rush back into work because he was the trauma surgery supervisor at this particular facility. So amongst all the chaos of trying to determine what exactly was happening, short time later, he found out that one of the victims in this tragic shooting was a surgeon that he worked with really closely and had known for many years. And it was pretty crushing for our family, for him, for his coworkers, and the whole community as a whole. This health system was so ingrained in our family with him working there about 10 years or so. Our children went to daycare across the street from this medical office building. And we ourselves saw many providers in the same building that this event occurred. And so this is a huge wake-up call for us in our city, and unfortunately in many cities around the country, that no matter what area you live in, whether it's rural, urban, suburban, the trauma and ripple effects of these events really shake the entire community and healthcare workplace.
So what are the specific risks for rural health? You have property crimes such as theft or burglary, substance abuse related attacks, mental illness related assaults, interpersonal or domestic violence. Typically the offenders are, what we've been finding are the offenders are younger, male, low education, low socioeconomic status. That doesn't mean that it's only these offenders. But that's the trend on the statistics that we're finding, which is very few and far between. And then victims tend to be older, female, or there's someone that's actually being victimized by someone that they know. Usually whenever we look at a facility to evaluate it and try to understand its largest vulnerabilities, we do a crime analysis and rely on crime reports either done by a third party, or we do the research and see what in the specific area, what tends to be the crimes that trend for that area, so that we can then be able to know what we're going to be designing for. Oh, did I go before?
Okay. So let's get into what is CPTED. CPTED is crime prevention through environmental design. And it's defined as the proper design and effective use of a built environment that can lead to a reduction in the fear and the instance of crime and the improvement in the quality of life. So this isn't just a single idea, it's a whole toolbox of strategies that can apply to hospitals, clinics, parking lots, parking garages. It's all about solving the specific problems in your area.
So the goal of CPTED is to reduce opportunities for crime that may be inherent in the design of the built environment. Some of the things that we think about, it's just really important because in designing these spaces, because it sets up the spaces to passively take on some of the work of security. If you think about if you could have all the security personnel in your facility that you could have, like how many would you have? That could be then reduced by the design of the space, because it's passively working for you to help mitigate some of the features that work against you in your facilities on finding or identifying. So one of the things that we do is we look at, CPTED kind of takes on like a layered approach. We're not saying that only the design gives you the ability to help lower the risk of crime, but it's all of the things working together. So natural security, that's the design, the way that it's implemented. And then mechanical security, you have all of your like card access and metal detectors. There's new technology with AI that they have where you can start to implement that. And then of course you have your organized security. And this doesn't just mean that it's organized security like security officers or personnel, but also your staff that may be trained in a way to start recognizing things that could elevate or become a problem. So basically it's the prevention is like the anticipation or recognition, but you're trying to remove and reduce that risk through all of these factors. So CPTED alone, its 4 principles are natural surveillance, natural access control, territorial reinforcement, maintenance, and management. And those are the 4 main parts of CPTED. Natural surveillance is basically the idea of an unwanted activity is less likely to happen if the criminal feels like they're being watched. Natural access control is the practice of defining spaces that communicate and they're being controlled and a part of that specific activity of business. So basically, it's you're making sure that people understand that there's this is a space that they don't necessarily need to be in whatever way that is implemented. So territorial reinforcement, the use of the physical attributes to support a transition from a public space to a private space, or the area that is defined for the use of that particular activity. And then maintenance and management basically helps reinforce and keep the sense of a safe space. It communicates to users that that space is cared about. It gives the people that use the space a sense of ownership. We use a Venn diagram here to illustrate all of this, because you'll start to notice in some of our upcoming slides that there are characteristics of all of these that help support the other factors. So basically, you'll start to notice that this sounds a little bit the same as one of these other principles. Well, it will, and you will see some design features, but they each have their own job to do in design. And added to that, we like to show activity support, and you'll see some slides along the way that towards the end that will explain to you how this is important, and the way that in healthcare it can be implemented as well, and not just in the idea of like a community.
All right, so let's dive into some of these CPTED principles and how they can apply to rural health. The first concept being natural surveillance, the placement of physical features and activities and people in such a way to maximize the visibility. So this increases the threat of apprehension by taking steps to increase the perception that people can see, be seen, and are readily observed. Natural surveillance involves design choices that maximize visibility. So crime hates the spotlight, right? Offenders look for opportune places where they can be concealed. No one's watching them. No one's going to see what they're doing or who's doing it. So lighting is the single most cost-effective deterrent to crime, especially at night. The lighting standards at your facility should meet the IES recommendations that focus on illuminance, uniformity, and glare reduction. So here's a street in our city downtown where we're located in Tulsa, and it's a really good example of several elements working together to elevate the natural surveillance. So imagine before all of these upgrades were completed, we would walk this street often, and it wasn't particularly comfortable. It was mostly people loitering. Some transients might have been camped along here. Storefronts were vandalized with graffiti from time to time. So by increasing the natural surveillance with the public art and paying attention to specific landscaping, optimizing those shop windows and special pavement treatments, it really elevates the comfort and safe feelings as pedestrians use this street now. The fear and instance of crime has gone down, and really positive activity was promoted here and generating better business conditions. Windows and entrances, the main goal here are easy observation of surrounding areas. How can we get those clear sight lines in and out of spaces that provide the comfort of traveling from one area to another? Removing any areas of concealment or barriers that block view, well-placed windows giving eyes on the street are very important to consider. Landscaping plays a huge part here in natural surveillance. It's recommended to follow a 2-foot, 6-foot rule as far as no shrubbery or bushes higher than 2 foot, and no canopies of trees or limbs that are lower than 6 foot. So this is a really good rule of thumb, especially as we talk about maintenance later on, to ensure that those clear sight lines are maintained and that nobody can be concealed behind the landscaping. Along pathways, 30 foot is recommended of clear sight lines for walking paths that are feeling safer. Also gives the opportunity to divert in time if there is a threat that occurs along the way.
So basically, whenever you're choosing, or like the landscape designers or facilities maintenance, like grounds maintenance, whenever they're choosing the landscaping, the different plant varieties and things like that, they need to look at what like mature heights are, and those types of things. And if there's a desire to have a certain type of landscaping, shrub or something, and it does grow higher than the 2 feet, but it will be well maintained and kept lower, then go for it. But basically, it's just the idea of keeping in mind during your selection process of what those do. So natural access control is one of the principles. We have basically, you're wanting criminals to learn to recognize, I mean, what's a good place to prevent crime or to commit crime, thank you, or like a bad place. And so you want your built environment to support that. And they can be associated with the safe targets or unsafe targets. So basically, what kind of position are you putting your staff when they're walking from your parking where they're supposed to park to the building or the facility? Are you putting them in an area where, as they're walking, is it an unsafe area, like they're easily targeted? And then natural access control seeks to establish cues that the project that indicate ownership of a property. So we talk about that a lot on some of the things, just like we talked about on the street. So basically, we're not saying that you should have a hospital that looks like a fortress. You want all of the things that make the space seem inviting, but you want to have all the things in place that help with the access control to make it harder for those sneaky types to slip in unnoticed, basically. But you want to be like, sorry, criminals, this is, a party invite only. You want it well defined. So the challenge is, how do we do that without creating this kind of fortress feeling? And basically, you're wanting to create something that's more inviting. So this, would you say, is more inviting than that fortress look, like really protecting everybody that's inside? Basically, here you have a more desirable point of entrance. You have a lot of natural sight lines for the natural surveillance. Entryways can be the most vulnerable location on approach to a facility. So you want to make sure that it's well-defined, well-lit. You have this single point of entry, and that it's overlooked by the windows so that people feel as if people inside can see them. And basically, this is also a celebrated entry, so it really talks to and starts to help people navigate into the space. We have the areas that you kind of want to watch for access control. You can start to define those areas with it's like from public to private, or like a site. So you see here, like the landscaping is used to help define the area. You're starting to enter our site. This is where you enter. So you're directing them by using signage like wayfinding. But you can do that with the landscaping. You can do that with fencing. We'll talk about that a little bit later. You don't necessarily have to have gates just because you have a fence. That's there just to help define the space. The lighting can be used along the walk paths to start to create that natural rhythm of here, this is where you go, but that's also helping to emphasize safety on the lighting portion of natural surveillance, giving way to giving eyes on spaces and not creating dark spots or concealed spaces. There's also target hardening. And one of the things that you'll think about, oh, sorry, hang on.
But you can't hit with a rifle
I can't
as
find
far
it.
as I can swing with this bat.
Pause it, yes, go back a slide. So on target hardening, we do think about like ballistics and things like that, but we're not just talking about ballistics. I am going to show a video here.
Maybe it's the butt of a rifle. But you can't hit with a rifle as hard as I can swing with this bat. So Chris is back there.
Okay, so go ahead and have the words show up. So basically, you're creating a space that's safe. There's other ways, like putting steel in the emergency room walls. This is a film that can be used on glazing on the exterior of the building or at some kind of desk. But it's basically that it can be done with the ballistics glazing, which can buy time for security to get to a space. It also allows for the users of that space to be able to retreat and seek cover. You're controlling the access to the buildings and conducting the surveillance of specific areas to reduce opportunities of crime to occur because you're still allowing that natural surveillance. And basically, you're not just, okay, so backtracking, basically you're doing this to help buy time and you're not going to prevent crime, I guess is what we're saying by doing these things. You're just buying time and creating a safe environment for the people that are in this space, but giving them time to get away from the threat. Go ahead.
All right, so territorial reinforcement. This is all about ownership of a space. So the use of physical attributes such as fences, pavement, art, signage, landscaping. You're clearly defining what's public, what's semi-public, and what is private. So by helping pedestrians understand where they should be, areas that might be off limits, and express that friendly management of a space. So here are some examples of using those physical attributes. They express the ownership, sense of place. So fencing at the perimeter should always be transparent, so allow surveillance through the fence and clearly defining that property line of what's yours versus what's theirs. Using signs to specify the approved or prohibitive behaviors on the property. Can also be used to direct patrons to parking and specific entrances. Landscaping can also do the same, defining territory and controlling access. So here are two examples of the territorial reinforcement. On the photo on the left, you'll see a bench positioned here that encourages interaction, the tree line that delineates space and pavement pattern changes to help define property. And this is opposed to an actual fence set up with transparency to accentuate private property. Bollards can also be used for territorial reinforcement. Their clear border definition of this controlled space, clearly defined transitional zones indicating movement from one area to another area, and what kind of activities would be acceptable here, where you can drive your car, where you can't drive your car.
So now we're talking about the maintenance, and basically the continued use of space and its intended for the intended purpose. It serves as an additional expression of ownership. It prevents the reduction of visibility from landscaping overgrowth and obstructed or inoperative lighting or equipment. So just the typical maintenance that you would have for your facilities. This is something that we can all identify with sometimes whenever you're going through any kind of setting, rural or urban. The broken windows, that's not an inviting space. You do not want to go, you do not want to go there. Not saying that you guys allow broken windows at your facilities, but it goes to this theory of if you're not taking care of the minor crimes or the maintenance of things, then it could help lead to more serious crimes happening in those spaces. So addressing and targeting minor crimes or minor maintenance issues, it may seem minor, the more that is recognized as that's not being taken care of, it starts to lead to the ability for more serious crimes to happen in those areas. Which one of these seems more inviting? Obviously, the one on the right. You can see here where just a simple cleanup and trimming of the bushes, putting in a light fixture, mowing the grass, a sense of this space is cared for. You can see the windows, so they know that people can see them from within the house. You can actually see back through the side. I know the other image isn't angled to where you can see, but you can tell that those bushes are kind of growing over the driveway, and which prevents some visibility as to what you're going to be approaching if you're pulling into the driveway to park and then getting out of your car. In this sense, you can see all the way back to the garage, which may before have been prevented by those bushes. But just your typical maintenance, even around buildings and commercial settings, is a big deal. We also have a scenario like this. If you're walking along a sidewalk, it doesn't feel real safe, but this one is much more inviting. You're separating from the vehicles on the street, which provides a place of concealment for areas where people could attack from hiding in between the cars. So it kind of gives that sight line of the 30 feet thing, even though this isn't 30 feet. It gives you time to retreat from a point of threat. But you're giving a perception of safety, providing a separation between those vehicles, and you have a nice walk path with no debris or any of the material. You see sidewalks that are all cracked and has loose parts of the concrete around. But basically it's just, you're less likely here that somebody is going to attack you. You feel more safe here. Again, here, the entry, this is likely probably a back door going into probably a staff entry. And you can see here how it feels much more safe. Nobody's concealing themselves behind this, like within the shrubbery. You know what to anticipate as you're walking to the door. Here's an example of what can happen whenever shrubbery is not maintained and kept trimmed. All along, this gentleman was hiding back here. So we had mentioned the activity support, so community and activity support. Within the healthcare facilities, you might start to think about ways that you can generate activity, because a lot of times these healthcare settings are the space for a community to go to feel safe, and it's kind of like the heart of the community. That's where they go for wellness and to get better or for an emergency. So it's important to consider how your community and the activities can support the safety and security goals of your space. So we have that basically that the crime prevention is not just the job for the police, it must also involve the entire community. So community or locally based crime prevention programs can work to increase the sense of safety and security for the residents, to respond to community concerns and crime problems affecting the population, and to increase the services and social cohesion in the community. So you feel safer, the incidence of crime starts to reduce, the community feels like they are a part of this facility. There's connectivity. It's placemaking events to help maintain those community relationships. The outreach development for youth programs, or like free health and wellness checks. Maybe mentorship and education support, senior support programs. Basically, the engagement programs can just help pull the community in, which when they start to feel that sense of ownership, when they're there visiting as well, they start to take care of the space in their own ways. They start to care about it a little bit more. Example would just simply be not leaving trash or debris sitting where they were waiting for their appointment. Creating environments that encourage legitimate use and users. So whenever a space is actively engaged with positive activities, then you're less likely to have the illegitimate users or unwanted users.
So let's talk a little bit how psychology ties into our CPTED strategies. The public perception of safety is strongly driven by psychology. A large component of that is color. So we cannot escape color in our lives, and it's so important because it influences us psychologically and physiologically. So corporate America has really had this psychology of color figured out for decades. And how can we implement the color strategies into CPTED practices? So a couple of facts about colors. The best color to attract attention is yellow. The best color to slow down pulse rate and relax someone would be blue. Green suggests feelings of calm. Orange stimulates learning, and red is the color that can elevate blood pressure, perspiration, respiration. And the strategic use of color, light, and texture are tools that we use in design to influence feeling and behavior, the perception of the space as a whole and how it's used. So in this example here, two nice designs of a waiting room. Which one feels more inviting, comforting, calming, and safe? It's going to be the one on the left that has the blues and greens, brings in lots of natural light, clear sight all the way across the space. So this is just one small example of how we can be strategic in implementing color and the harnessing the power of psychology that goes along with that. So in summary, the benefits of CPTED are the reduction of crime, the reduction in potential for crime, and the greater perceived safety and security of a space, whether outside or inside.
Basically, you're using these principles to be proactive versus reactive, and they're built in versus tacked on, intentional and not accidental, and it's layered. So there's multifaceted aspects or characteristics of your space. Now, I will note that this isn't just like you can only implement it with new construction, new facilities. You can go into spaces and retroactively start to apply these principles. It's just looking at a space and then determining how you want to do that. And of course, money's always a factor. We will say that, but there's always some kind of solution that we could look at in order to help make spaces safer.
And it's really just targeted to your specific problem or circumstances or something that you're struggling with as a facility, really building on these strategies to harness something that will improve safety, improve the fear and instance of crime.
One of the things, real quick before we just move on to question and answers, is on rural healthcare, what we found is that statistics are not real. We don't know that they're real accurate. A lot of crime and violence in healthcare already goes underreported, but in the rural healthcare setting, in some of the research that we've done, we have found that there's various factors that could be contributing to this lack of statistical information. And some of those factors might be that people are afraid to report for the purpose of retaliation. Like people know people so well in a smaller area that they don't want to report it because then they're afraid that the person they were victimized by them, by that person or their family, they might be even more victimized by them. So there's just a lot of things that are things to be solved and things to consider. So any questions or answers that popped up during the presentation or that we can answer?
So one question I see here is, you guys talked about the rurality going underreported. Is there any correlation with gun ownership in rural areas and access that may be beyond what you guys are prepared to talk about? But
no, this discussion did come up at one point in time when we were researching. We do not see any correlation with gun ownership in rural areas versus urban areas. It's more of, you don't see as much gun violence in the smaller communities as you do in the urban communities, even though you would think that you might, because it seems, at least in our area, it does seem like you have more gun ownership in rural areas. So usually the crime that happens in rural areas that we're seeing, it tends to be more like physical or vandalism or burglary. So it's more like attacks and not necessarily with a gun.
interesting. Okay. Well, not seeing any other questions come in yet. We'll go ahead and thank everybody for your time today. If you have any other questions, I'm certainly Caitlin and Elizabeth will be happy to answer those for you, and you can reach out to them. Again, we have recorded today's session and should have it up on our YouTube channel by the end of next week. But I just appreciate everybody's time and hope you have a great day.
Thank you so much.